And then the next pattern that I'm going to talk about is damp heat in the liver and gallbladder. So the clinical manifestations is hypochondriac distension and pain, bitter taste in the mouth, fever, low grade, continuous fever, poor appetite, abdominal distension, nausea, vomiting, feeling of heaviness of the body, vaginal discharge, pain, redness of scrotum, vaginal itching, scanty yellow urine, painful urination, burning urination, jaundice. And the tongue looks like you have a yellow sticky tongue coating, and the pulse is wiry rapid. And the treatment principle would be clear heat and dry damp. So this is a very complicated pattern because it has both the heat and then the damp. So the point prescriptions are liver 14, the front moon of liver, and then gallbladder 24, front moon of gallbladder, GB 34, which is the lower Hesse point of gallbladder, and then there's bladder 18, which is the backshoot point of liver, and then there's bladder BL19, which is the backshoot point of gallbladder, and then there's Do9, which is 至阳. This is a point for dampness. Then Ren12 is the front view of the stomach, and then it's the same. It's called 中脘. And then spleen 9 is the water point, and then spleen 6 is 三阴交, spleen 3 is the yuan source point, which of spleen that will tonify the spleen. Large intestine 11 clears heat. Liver 2 also clears heat because it's the yin supreme point of liver channel. Damp heat in the liver and gallbladder. So there's a lot of symptoms and there are a lot of points. I don't know if I can remember everything. So this is when there's damp, it's always tend to go downwards. So that's why there's gonna be the heaviness of the body, and then the vaginal discharge. This scanty urine is probably because of the heat, and abdominal distension, nausea, vomiting, poor appetite. Also, so there's quite some points for the spleen. And fever, because it's damp heat. So the fever cannot be very, very, very high fever because damp is cold. It will cool down the body. So it's a low grade fever and it's continuous. So I guess this is one of the very, very special clinical manifestation for damp heat in the liver and gallbladder.